Hey, I'm here with Adam and Heather Raymond. They happen to be my neighbors, so that's really cool. They moved in last year. Adam is the city manager, and Heather is involved in public affairs with Kaiser Permanente. So thank you guys so much.
Thank you for having us.
Thank you.
It's been a crazy week, and you both have these enormous jobs of responsibility. So I am so grateful that you're taking a moment of your afternoon to come just kind of chat with me a little bit. And thank you for being great neighbors too.
Thank you.
They also have two kids, Parker and Cooper, and so it's really great to have you. Now, okay, so Adam, I want to start with you. You're the city manager of Glendora, so I thought my job was complicated as a pastor of a local church. I can only imagine the complexity of your job, right? So have you ever experienced anything like this before? And like, what are the unique challenges for you in this particular situation?
Sure. So, local agencies are great at emergencies, a fire. This is sort of unprecedented for many of us because it's so many levels of bureaucracy all at the same time, from the feds to the state to the county and to your city. So many voices to be heard, so much information that's out there. And we don't have a patient currently in the city of Glendora that has contracted COVID-19.
Yeah.
So people oftentimes, with all the information, they're looking to try to find that source, what's going on. And so we are being asked to make decisions that help stem the spread of the virus before it gets to Glendora or our local community. So we are being forced to evaluate options that we just never have before, like closing a library or closing a community center.
I heard you
those
closed the
sacred
library.
cows. Yes, we did.
Man,
Yeah, sacred
that's
cow.
almost as bad as me closing the church.
Yeah, almost. So, when we make those decisions, we don't do it lightly. And so we try to put as much information that's out there on our website, cityofglendora.org/COVID-19.
Yeah.
So where you can find all your information. So the biggest unique challenge we have is trying to make sure that people get the information they need and not panic.
Okay, so you're involved in obviously communicating a lot, right, on a lot of different channels. And so if people are listening in and they're like, hey, why did he choose to, close the library? Or why did he choose to close the LaFetra Center? Because, like, what would you say to them? How can you kind of help them process that a little bit?
So when we get information, we are reviewing that information from county public health and from the state of California when there was an executive order issued that talks about you cannot have more than 250 people at one time, and they really say that we should not have 10 more people that are at risk in the same room less than 6 feet apart.
Okay.
And so when we evaluate all of our facilities, they're heavily used. And so we are trying to do our best to not help those at risk contract the virus. And so we are reviewing all the information, looking at our facilities, trying to find ways to keep them open, but we know sometimes it's in the best interest of everyone just to take a brief break. And so we're going to do that for a month. We're going to keep the staff working. We're going to make sure those facilities are better than ever when it's time to open them up.
Okay, so that's great, right? I mean, we're looking at a month, at least you're looking at a month. You evaluate things probably every day, but what would it take, Adam, like as you kind of project out, what would it take for us to get to the place where we would maybe start to loosen up some of the restrictions again? What does that look like in your world?
Sure. So when we look at county public health specifically for the county of Los Angeles, if they made mention that it's okay to be in close proximity again, or the virus is on a decline, we could move immediately to open those facilities, literally within 24 hours. So we are constantly monitoring the information that's being provided to us. We're on daily conference calls. We're talking to other agencies. We probably spend 6 or 7 hours on the phone with the various department heads and their counterparts in other cities, and reading all the information that's passed our way.
Yeah, okay, so man, that's a lot. Now your wife has a complicated job as well. Heather, just talk to us a little bit about, you're the director of public affairs for Kaiser. Like, this is one of the major healthcare providers, probably in America, I would assume. what's that like? What are the challenges that you're experiencing? And like, why is it important? Like, we canceled church.
Right.
Like, why do you think I canceled church? Like, what's so important
Sure.
about this in terms of healthcare
Sure.
issues?
So as far as healthcare is concerned, and my position in public affairs, we're dealing with such a myriad of communication that's hitting us all at once, right? So everything's coming in, it's changing constantly. So we're trying to break that down to a level where everyone feels comfortable with it,
Yeah.
getting those messages out quickly. One of the biggest obstacles that we face from communicating those messages is actually social media. While social media is amazing and technology is amazing for things just like this,
Yeah.
we wouldn't be able to do this today were it not for technology and social
Absolutely.
media and things like that. But that platform has caused so much more work for us because Joe Smith down the street has a friend of a friend who knows somebody that works in healthcare and says this, that says there's a case and the hospital down the street's not telling you about it.
Okay.
So I would encourage everyone in your ministry to really take the time to follow either the CDC website,
Yeah.
our local government website for the latest information, or definitely your county health department. Those are the places where you're going to get the best information. Of course, I'm partial to kaiserpermanente.org, excuse me, where you can go on and also find those updates, but find a credible source, not using this platform of social media
Yeah.
to incite fear
Yeah.
in people, when really these are opportunities for us to show the best of ourselves.
Yeah.
We see some of the ugly come out, and that's really unfortunate.
You and I were talking about it on the street the other day about our trip to the grocery store,
Right.
and just sort of the anxiety that's around this thing. So when we talk about social distancing, one of the reasons, at least that has been explained to me, that we're engaging in social distancing is because we want to prevent this disease from spiking so much and then overwhelming our healthcare system. So maybe you can just talk about that for a minute. Like, why is that so? What would be so disastrous if this thing like broke out? What would happen? Like, because I've been told there's not enough hospitals, there's not enough nurses, there's not
Sure.
enough doctors.
If this truly broke out into a major epidemic, our hospital systems couldn't sustain the number of people that would come in. So kind of leveling the platform, if you will,
Sure.
and practicing social distancing. I know that it's unfortunate that we had to close schools. It's unfortunate that your members can't come and practice
Yeah.
tomorrow, or today. I guess this will be showing on Sunday. It's important that they understand that they're really doing what's best for the community, because the onslaught of people that would come in at once because remember, we're still dealing with the flu, which is high risk. We're dealing with cancer patients. We're dealing with all of the things that we deal with every day, and then to put this on top and have hundreds of thousands of people converging on a hospital at once. So we would ask that the public really take a moment to think about their symptoms, how they're feeling, and not rush to a hospital. Take a moment, make a phone call your healthcare practitioner.
Yeah.
They will talk you through the right steps. I can tell you at our medical centers, we now have triage areas set up outside of our emergency rooms so that we can use the emergency room for the person who might be in cardiac arrest. All of those things that are happening that we really need to focus on all of the time.
So it's really, it's like really preventative, right?
Absolutely.
And I think that's one of the things that we struggle with. Churches we never close our doors unless you live in the East Coast for a snow day, and but like on the West Coast, we're always open. And I think it's difficult sometimes, Adam, for people to think, it's never going to get that bad. It's never going to do this, and to think, maybe it won't, because we're actually doing these kinds of things, right? One of the primary reasons that we canceled church today is because I wanted to honor and respect. The Bible calls me to respect the authorities, that are in place, and you guys were making decisions pretty consistently that led us to believe, no, it's not a good idea for us to meet. And so along those lines, like Adam, this is a great opportunity for Christians to serve our community, right? To show compassion and mercy and to help other people. as the city manager, how can we serve you, help you, pray for you, support you, and just reach out to our community? Because that's actually what Christ calls us to do.
You know, one of the most important things is when schools are shut down and cities are closing facilities and the state's telling you, you know, be prepared. It's to not forget to check on your neighbor. It's to don't be afraid to call those people that are in need, people that you know are elderly and need help. It's okay to check on those people. In fact, it's most important now than ever before, because it's scary for people who don't get the information. It's scary for people who are used to attending a city event and seeing their friends and being told you really shouldn't do that, you're at risk. And it's not, if we don't forget about those people, we make everything better. You know, we have a lot of local businesses that will see a decrease. It's really important for us to shop local, shop in your city, shop at those, you know, at those stores, because that is their livelihood. And also to be involved and to advocate. So currently there's a bill that the Senate will hear that will provide funding for businesses to help pay for people to stay home for childcare. And that's really important because that's scary for people as well. And so it's not being afraid to ask questions, looking at the right place for information, and looking at your fellow neighbor, your fellow man, and saying, what can I do to help? And then finding the safest way to provide that help.
Yeah, okay, man, that's good. We've been studying the Sermon on the Mount, and a couple of Sundays ago we talked about the golden rule, right? Do unto others as you would have them do unto you. And
So simple.
so simple, isn't it? But sometimes when we get in these kind of panic situations, we tend to hoard. We tend to kind of just think about ourselves first instead of our neighbors. So, man, that's really good. And we're trying our best here to make sure we're blessed to have a multi-generational church, and so we have a particular concern for those folks that, this particular virus, a little bit more hazardous for them. So we're trying to pay close attention to that. But so I want you to know, particularly you, Adam, that our church is here to serve you and our city. So
Thank you very much.
You live right across the street from me, so you can just come knock on my door. But we want to take this opportunity as a church to just serve our community and say, listen, you know what? God promises to take care of our needs, bottom line. And so as we serve other people, somebody told me last week about when you're on a flight and there's turbulence and the flight attendant is all stressed out and anxious, it makes me stressed out and anxious. But when they're calm and collected and they just get on the microphone, says, maybe sit down, put your seatbelt on for a little bit, it just brings a sense of calm to us. And so I appreciate both of you, your calm confidence, your professionalism. It makes it easier for us to follow some of these decisions that you're making. So
Thank you.
Thank you.
Yeah, and please know we're going to pray for you. We continue to pray for you, and we're here to serve you, okay?
We really appreciate that.
And thank you for giving me a few minutes of your afternoon. It's been a crazy week, family. Like, we live right across the street. I can tell you these two have been working around the clock. So, hey, thank you so much
Thank you.
For being here.